Hello, everyone, and welcome to today's live webinar, Preclinical Behavioral Models of Anxiety-Related Disorders. My name is Diane Warlier. I am the marketing manager here at the Neuroservices-Alliance, and I will be moderating today's webinar. This live event is part of our 2021 innovation series that focuses on showcasing our members' innovative assays and technologies. Every webinar is presented by one of our neuroscientist experts and lasts 30 minutes, 20-minute presentation, followed by 10-minute questions and answer. If you have any question at any time, please do not hesitate to submit them in the question box that is located at the bottom of the GoToWebinar panel. And Dr. Cyril Herry, our expert today, will answer the questions after his presentation. This session is also recorded, and you will receive the recording after the live session. Before starting, I will just say a few words about Neuroservices-Alliance. We are a consortium of CNS contract research organizations specialized in vitro and in vivo electrophysiological and behavioral studies. Our goal is to deliver endpoints facilitating decision-making to our clients for their CNS drug discovery programs. We value direct and efficient interaction with our clients, and we rely on a team of more than 50 PhD scientists. As a speaker, we have Dr. Cyril Herry with us today. Dr. Herry is a research director and co-coordinator of the OptoPath platform. As a member of Neuroservices-Alliance, OptoPath is dedicated to innovative experimental research in CNS psychopathologies. Hello, Cyril, and I will let you take the lead from here.
Good morning, everyone. So I'm Cyril Herry, and before to go into the detail of the presentation today, I would just mention the OptoPath platform. I'm co-coordinating this platform, which is a behavioral neurophysiology platform. The idea we develop on that platform is to combine electrophysiology with a specific form of behaviors and also to analyze neuronal signals. Today, of course, I will particularly focus on behavior and particular anxiety-related behavior. But I just wanted to make the point that the platform is also designed to perform voice recordings during anxiety behavior. So today we are going to cover two main topics: the classical anxiety fear models we have developed in OptoPath, but also on a second step, the specific anxiety fear models that will try to address a specific question related to some disorder. I will have a particular focus on post-traumatic stress disorder and the specific question we can model with our models. So just to start with the classical anxiety fear models, you all know that anxiety can be evaluated using the elevated plus maze or the open field. The idea is that those tasks are a rodent ethologically relevant task, and they are based on their preference for confined space. In the elevated plus maze, the animal has a tendency to spend its time in the closed arm in comparison to the open arms. And you can measure the time spent in the different compartments to evaluate the basal anxiety of the animal. And with anxiolytics, they will spend more time in the open arms. For the open field, the animals have a tendency to spend more time in the corner compared to the center. But if you, and this is an experiment we have done in the past where we submitted mice to an open field and we play two kinds of sound, a control sound and a stressful sound. And when you play the stressful sound, you see that they kind of start to avoid the center of the apparatus. So again, this gives you a global idea of the basal anxiety in those animals, and this is really sensitive to anxiolytic threat. We also have different tasks that we have developed on OptoPath. The light dark box task, which this time is based on the rodent preference for dark spaces. They prefer to stay on the dark compared to the light arena, and you can measure the number of crosses they make in this light dark box. And the idea again is measure basal anxiety levels. And I will discuss now a paradigm which is called the startle or the fear condition startle, which has been developed by Michael Davis decades ago. is quite interesting because you play a loud sounds that make startle the animal, and if you associate light with a food shock, for instance, and if you present the loud sounds, then the light and to the animal, the startle response will be potentiated, which is called the fear potentiated startle response. And the difference between the FPF and the basal startle give you an idea of the basal anxiety of the animal, which is also a different way to look at basal anxiety compared to the task I was just mentioning. So of course we provide those different assays in OptoPath in combination with pharmacology or with electrophysiology if you're interested in that. There is a task that we have developed recently, and we have published a paper about that, which is called the place preference condition, or condition place preference. You have an arena with two zones, and you have a small hurdle in the middle, and the animal can cross the two compartments. And we often use this compartment to evaluate the effect of some manipulation. In this particular case, it was an optogenetic manipulation of the prefrontal cortex. The idea was to evaluate whether the optogenetic manipulation was aversive or was inducing anxiety. And you measure this anxiety by scoring the time spent by the animal in the zone where you play the light in comparison to the zone where you don't play the light. And if they are show anxiety develop anxiety following the stimulation, they will spend most of their time in the compartment not stimulated. In the particular example I'm showing, you can see that they spend equally the time in both compartments. We have the GFP control and the channel, the optogenetically manipulated animal, and we didn't see any difference using this strategy. But this is the global task we can use also for measuring anxiety levels in rodents. Just to finish with the classical anxiety fear models, I will discuss one model we have developed recently in OptoPath, which is based on innate fear behavior, and is called the looming or the sweeping test. The idea is that you use the the natural behavior of the animal, that are rodents. They try when they have a cruising, it mimics a cruising predator. The sweep situation mimic a cruising predator, and in this particular situation, the animal has a tendency to freeze. Whereas if you play a stimulus that is mimicking an approaching behavior, which is called a visual loom, then the animal will flight and will move into a shelter. So we have used this paradigm to perform recordings. This is an example of lateral abenular recordings with some neurons recorded in this region. On D panel is the apparatus. You have a screen able to show either the loom stimulation or the sweep. So the loom is you go from a small circle to a large circle. And for the sweep stimulation, the circles stay at the same size but translate slowly in the screen. And you have on 5 a shelter zone where the animal can escape and get below the shelter. And on the bottom panel, what you see is the reaction of the animal upon the loom situation, where you have a freezing behavior or a flight behavior that are induced by the loom stimulation. So it was just to mention that we have also this task is based on innate fear behavior, and it's not really anxiety, is more related to innate fear behavior, but might be interesting for some of you. Now I will discuss the specific models of anxiety-related disorder, and I will have a particular focus on post-traumatic stress disorder. And there is a different feature of PTSD that are quite interesting, and we try to model in OptoPath. Of course, PTSD is a complex disorder. You cannot find a single model that will recapitulate all the particularities of this disorder. But here, what we try to do is to identify really key elements of the pathology and try to develop a model to evaluate this particular aspect of the pathology. The first one is what we call the relapse after treatment. In PTSD patients that are submitted to exposure therapies, what you observe often is that that the vast majority display a fear relapse after the treatment, and this is exactly what we try to model in OptoPath, and I will discuss that in a moment. The second one is based on the fact that PTSD patients have a tendency to show to avoid places where they are related to the trauma. And so we have developed an avoidance task that can be used to identify this particular parameter. Another important feature of PTSD is that they have a tendency for contextual generalization. They over-generalize safe contexts, and they identify them as a dangerous context that could be related to the trauma scene, and this is what we model here. And the last one that is quite interesting is that PTSD also show comorbidity with pain disorders, and this is exactly what we try to model in the last sections that I will present to you. So let's start with the relapse after treatment, and to model this particular phenomenon, what we use is classical Q-fear conditioning, where you associate a CS, a conditioned stimulus like a sound or a light, with a mild food shock, a US, given to the animal in a particular context. And after a few of such pairing, you see an increase in the fear reaction in those animals. And the model is interesting there when you perform what we call an extinction, which is mimicking exposure therapy in humans. Basically, you present the same CS, but this time without any aversive consequences, and you do that in a different context. And what you will observe is a progressive reduction of conditioned fear responses with time. Interestingly, if we introduce a delay between the extinction and the test that we call the retrieval, what we observe is that you have half of the animal, not all, but half of the animal that will show a recovery of conditioned fear responses. And this is quite interesting for us because it would be a kind of model of the relapse after treatment observed in PTSD patients. So let's see the data about fear conditioning and extinction. So on the B panel, what you see is fear conditioning. So we use usually two sounds, the CS minus, which is the control sound, and the CS plus, which is the sound associated with the food shock. So on baseline, and we measure the freezing, the immobility of the animal. So just after, if you measure the baseline, they are not afraid of the context because they freeze around 10%. They are not afraid of the CS minus after conditioning because the CS minus is the control sound, so they freeze around 20%, but in comparison, they freeze a lot to the CS plus. As you can see, they freeze up to 60 or 70%. And what you can see is that over the course of extinction, they progressively decrease their conditioned fear responses, up to reach CS minus levels. And what is interesting for us was the retrieval day on day 10, 1 week after the extinction. When you represent the CS minus and the CS plus, you see that you have a small recovery of the conditioned fear responses to the CS plus compared to the CS minus. And now what we did, we look at individual mice and quantified what we call the percent rebound of fear. Basically, is the difference between their freezing level at the early extinction compared to the retrieval. And you perform an histogram on those values, and what you can see is that some animals show a low fear rebound and some animals show a high fear rebound. In other words, some animals show high fear recovery and others show low fear recovery. And using hierarchical cluster analysis, we could split this entire population in two populations, the low fear recovery and high fear recovery. And then we went back to the extinction curve to evaluate what was the dynamic of the extinction in those two populations. And what you can see, interestingly, the freezing level initially at early extinction is really similar between the two groups. They extinguish very the same. But what is interesting is that at relapse time, at retrieval time, what you can see is that we see the split between the two populations. So indicating that, and this is half and half, 50% of the animals show low fear recovery and 50% show high fear recovery. So this is true in mice, and we try to develop the same protocol in healthy humans. And this is what we have done. Of course, it was not food shock, it was finger shock. They were in the fMRI. This is in the fMRI apparatus, and we performed the behavior. So they have to, they were looking at some images, and they received food shocks, finger shocks related to some images. We have a CS minus and a CS plus. And what we see here is, if you look at the B panel, so if we look at the retrieval day, what we observe is we can always also split the people into low fear recovery subject and high fear recovery subject. And if you go back to the extinction of these two groups, what you can see is that they extinguish the same. And again, what was different is the retrieval session where we have high fear recovery and low fear recovery group. So this is quite important for us because we could replicate that in humans, in healthy humans as well. And to us is an important model to evaluate the relapse after treatment. The second model I want to discuss is what is called active avoidance behavior. So again, a PTSD patient have a tendency to avoid places or objects they have been encountering during the trauma. And this is mimicking the avoidance of places, of context. So what you do on day one, you habituate the animal to a CS minus, a control sound, and a CS plus. And what I have to do on day 1 to 4 is that you present the CS plus or the CS minus in one context, and they have to move to the other one to prevent the occurrence of a foot shock. So if they don't move, they receive a foot shock. This is called an escape response. But if they move, this is called an avoidance response. And as you can see, they quickly learn the task. In red, you see the performance related to the CS plus. And already after 1 day, they're already, after 2 days, they're already at 60% of performance, and then maintain that with time. So after two or 3 days, they already reach the maximum of performance, and this is quite different from the CS minus or what is called the pre-CS, that is the intertrial shuttling. And for us, it's quite interesting because you can use pharmacology or couple pharmacology with recordings to evaluate whether your particular drug will have an impact on avoidance behavior in rodents. The third model we developed a few years ago is called the contextual generalization discrimination model. You have an animal that is in a context A, and this context A has particular features. On this context, we play a sound, we have a particular light, and we have an odor. You can vaporize an odor, a lime odor. And interestingly, you can change the contextual element while the animal remain in the very same place. So for instance, you can remove the lime odor, you can switch the light, you can switch off the sound. And we condition the animal in the A context, and later on we expose them in what we call the A, B, C, A prime context that are variants from the A. So on 24 hours after the conditioning in A, where they receive foot shock in this particular context, we re-expose them for 3 minutes in the context A, and 3 minutes after that we switch off the odor that constitute the context B. We still have the light and the sound, and on context C we switch off the light, the sound, and we still have the odor off, and which make the context C. And then when we put all the elements back, this is the context A prime. And what you can see on the panel, on the bottom panel, in the E panel, we have two groups. We have the ABC A prime group and the group that was just submitted to the A context. And as you can see, we measure freezing responses in those two groups. So they freeze I to the context A, they freeze I to the context B, so they somehow generalize. And interestingly, they can really nicely discriminate context C for the ABCA prime group in comparison to the A group that still present high fear levels in the A context. So we have designed a task where the animal can discriminate a safe from an unsafe context. And what you expect is that animals or suffering from high anxiety will show high fear levels, will fail to discriminate the safe context from the unsafe context, and will present fear responses on the C exposure. So this is also an interesting model for us that capture one particular feature of PTSD disorders. And the last model I want to discuss with you before taking a question about that is the emotional regulation of pain behavior. As I mentioned, there is a lot of comorbidities with pain behavior in PTSD patients. And here we use a combination of what is called the emotional regulation of pain behavior. The model is the following one. On day one, we habituate the animal to a context A, where we place CS minus and CS plus. And on day two, they are submitted to a classical fear conditioning exposure, where a CS plus is associated with the US, but not a CS minus. On day 3, we test for the fear levels. We present CS- and CS+ in a different context. And on day 3, again, we submit them to the outplay to evaluate analgesia effect of the paradigm, because this paradigm is called a fear condition analgesia. So on they acquire freezing on day 2. If you measure the fear retrieval on day 3, you see that the CS+ freezing level are much higher than the CS- on the baseline. And interestingly, on the outplay test, what you do on the outplay test, you play the CS- and the CS+. And what you see, if you measure the temperature at which the animal withdraw the paw, or the latency to withdraw the paw, you see that you can see that on the CS-, they react much faster compared to the CS+. And this is interesting because this is a sign of analgesia that occur when you play the CS+. So this is a perfect emotional regulation of pain behavior. And what we expect in animals displaying high anxiety is that you prevent this analgesia to occur. And also, so that's the modeling we wanted to do. And this is to evaluate the reduced pain sensitivity. So this is, I finished with my presentation. I hope you enjoy it, and I will take any question if you have.
Thank you very much, Cyril, for this very comprehensive presentation. Again, everyone, do not hesitate to ask questions now in the chat. And I will start with a first question. What is the proportion of mice and humans showing fear recovery after extinction?
So when you look on the clinical data, PTSD patients, after therapies like exposure therapies, they usually 50% of the people show a recovery of previous trauma-related responses. And what is interesting in the model we have is that we have the very same proportion. It's 50% of the animals would show a high fear recovery on the retrieval test.
Okay, thank you. Have you tested reference compounds on the relapse model in mice?
Can you repeat the question? Sorry.
Have you tested reference compounds on the relapse model in mice?
We didn't test the reference compound like anxiolytics, but we have a good predictive validity on this model because on a paper we published, what we have done is to use a classical therapy that was used in humans, that is called the EMDR therapy, and we adapted to mice. So basically EMDR is based on bilateral sensory stimulation. And in mice, we performed the bilateral eyelid electrical stimulation that was mimicking this EMDR therapy in humans. And we observe interesting effect because we reduced the number of animals showing high fear recovery. And this was a long-lasting effect. It was lasting more than a month after the treatment. So it was quite important for us because it showed high predictive validity of this model.
Okay, thank you. So now, how do you know the assays are responsive to anxiolytic agents?
So on the classical assays I was discussing early, there is 1,000 of studies that have used anxiolytics showing that you impair the plus maze or the open field. That is, the animal spend more time in the open space or more time in the center of the apparatus. Concerning the specific task we have developed, we haven't tested anxiolytic at the moment, so we don't have any pharmacology to show. Again, for the relapse, we have a predictive validity with the model we have developed, in particular the bilateral sensory stimulation.
Okay, and also, do analgesics reverse the effects?
Analgesics. So I guess you are talking about the last part of the my presentation. We haven't used pharmacology on that model. We have rather manipulated some circuits in the periodical gray. So basically, what I can tell you is that in the in the ventral part of the periodical gray matter, there is the vast majority of inhibitory neurons are somatostatin expressing interneurons. And we have manipulated this population. And when you activate this population of somatostatin interneurons, the main effect is the reduction of analgesia. And what we have shown later on is an unpublished study, but we are working on that. We have shown that those neurons, SST, the main effect is not local, is because they project to the medulla. And from in the medulla, you have a relay, and then the projection to the spinal cord. And the inhibition in the medulla is important to generate to reduce the analgesic effect.
Okay, thank you. Now another that was asked before. So ideas on the mechanism, structures involved, and neuronal topes involved in the fear condition analgesia model.
So is a bit related to what I was just answering. Yeah. Basically, what we think. So what is not about analgesia is that it involves mu opioid receptors on certain kind of interneurons. What we have shown in the study is that we think the interneuronal population that is important is the SST, somatostatin expressing interneurons. What is maybe more important than this is that SST, they can be local in the dorsal pag and the ventral pag, and in the ventral pag, the local one have been shown to play a role in freezing behavior or defensive behavior. And the population we are really interested in is the one that project to the medulla, because those one are not involved in the defensive behavior, but really in analgesia, as I just said before.
Okay, thanks. And also one last, actually, I hadn't seen that maybe was related to what you answered before. Have you tested a wide variety of compounds to reverse effects?
No, so that's we don't have pharmacology on those data, as I mentioned before.
Okay, thank you very much, Cyril. For now, we don't have any additional questions. So I think we can now close the webinar. But of course, after your presentation, Cyril, everyone, you will receive a follow-up email with the full recording of the sessions, and also the opportunity to follow up and ask additional questions if you would like. Thank you very much, Cyril, for today.
Thank you.
And thanks, everyone. Please, also, you can answer the very short survey after the webinar. We appreciate your feedback. Thank you very much.
Thank you. Bye-bye.
Bye. Bye, Cyril. Bye, everyone.